If you're on Ozempic or Mounjaro, nausea alone can be normal, especially early on or right after a dose increase. Repeated vomiting is usually not. Pain that stays in one part of the belly is not. Trouble keeping fluids down is not. That difference matters, because the real danger sign is the pattern. Symptoms that keep worsening, dry you out, or stop looking clearly routine. These drugs help with weight loss, partly by slowing how fast food leaves the stomach. That can reduce appetite and improve blood sugar. It can also cause nausea, bloating, constipation, heartburn, and vomiting, especially early on or after a dose increase. In many people, those symptoms ease as the body adjusts. The problem is that the same slowdown can cross a line. Once food and fluids stop moving well enough, the issue is no longer just uncomfortable. It can become dehydration, worsening constipation, or pain that points to the pancreas, gallbladder, or bowel. Routine side effects usually ease. Dangerous ones keep pushing the body in the wrong direction. I'm Dr. Kim, a licensed physician. This is not medical advice. Consult your doctor. Many people judge risk the wrong way. They focus only on intensity. Mild nausea sounds less alarming than sharp pain, so they assume it is safer. But mild nausea that cuts food and fluid intake for days can do more harm than a short burst of stronger discomfort. Another mistake is thinking a symptom cannot be serious if you can still work or drive. That is false. Some problems build quietly. A person may vomit a little, look functional, drink too little, and eat almost nothing. The warning may stay hidden until dizziness, weakness, or low urine output makes it obvious. People also get fooled by the scale. Eating less gets praised. Fast weight loss can look like proof that the drug is working. But weight loss does not prove that your body is tolerating the medicine well. Eating less by choice is very different from being unable to keep up with food and fluids. There is another trap. Early side effects and early warning signs can overlap. Low appetite, bloating, nausea, and constipation may be routine at first. They can also be the first visible part of a larger problem. That overlap is why a symptom may look ordinary on day one. If it keeps going, spreads, or starts shutting down hydration and digestion, it may no longer be routine. That is where people get hurt. They keep pushing because the medicine seems effective. They treat worsening nausea as discipline and weakness as the price of losing weight. Sometimes weight is still dropping while dehydration or poor intake is building. Some people need extra caution from the start. Higher risk groups include people with a past pancreas problem, gallstones, kidney disease, or severe acid reflux. They also include people with a stomach that already moves food too slowly, a past bowel blockage, or older age. People taking other medicines that lower blood sugar need extra caution too. Weakness or nausea may get blamed on the stomach when more than one problem is happening. Someone may think the drug is just causing an upset stomach. Low blood sugar or dehydration may also be part of the problem. That makes the situation easier to miss and slower to treat. Risk also rises after a recent dose increase. It also rises when other medicines worsen constipation or fluid loss. People who already struggle to drink enough can get dehydrated faster once symptoms begin. People with long-lasting digestive problems also have less room for error. Dose increases deserve special caution too. Many people feel fine at one dose and assume the next step should feel similar. It may not. A higher dose can slow how fast food moves through the stomach. Foods that felt safe before may suddenly trigger nausea or reflux. The first week after an increase is the time to watch more closely. The clearest warning signs are repeated vomiting, inability to keep fluids down, and symptoms that keep getting worse instead of better. Severe or constant pain high in the belly matters even more if it spreads toward the back or comes with vomiting. Pain under the right ribs after eating can point to the gallbladder. A swollen, tight belly with cramping, constipation, and little gas or stool can mean the gut has slowed too much or become blocked. Some danger signs happen outside the belly and still matter. Very dark urine or much less urine than usual can matter too. Dizziness when standing can matter. Fainting matters. Confusion matters. A racing heart matters. Weakness that feels far worse than expected can point to dehydration or bigger trouble. Black stools, vomiting blood, fever with belly pain, or yellow skin or eyes are not normal adjustment symptoms. How the symptom behaves matters more than what you call it. Ask 4 things. Are you keeping up with fluids? Is the pain staying in one place? Is the belly still moving normally? And is the symptom getting worse? Expected side effects usually soften with time. Dangerous side effects tend to persist, intensify, or start causing dehydration, weakness, confusion, or other signs beyond the stomach. If symptoms are mild, you are drinking normally, and the trend is clearly improving, call your doctor for guidance. Do not stop the medication on your own. But that advice changes once fluids stop staying down or danger signs appear. Seek medical care that day if vomiting keeps happening or you cannot keep fluids down. Seek medical care that day if pain is severe or stays in one place. Also seek it if the belly becomes swollen or you develop black stool, blood in vomit, yellow skin, or fainting. If you cannot reach your doctor quickly, go to urgent care or the emergency room. When you call your doctor, bring useful details. Know which dose you are on. Know when the last injection was. Know when symptoms started. Know whether the dose recently changed. Know what you have been able to eat or drink. Know whether you are still urinating normally. That information helps your doctor decide whether you need tests, a scan, extra fluids, or a medication change. If severe symptoms are happening right now, do not take the next dose until you have spoken with a medical professional. And if you are told to go in, go in. Waiting for the next morning can turn a manageable problem into a more dangerous one. Prevention matters too. Follow the dose schedule you were given. Do not move up faster than prescribed. Prioritize fluids and protein. Eat smaller meals more slowly. Be especially careful after a dose increase. Review other medicines with your doctor if constipation, reflux, or dehydration becomes part of the pattern. Do not treat misery as proof that the drug is working harder. Success is not measured by how little you can eat or how bad you can feel. These drugs work best when your body can tolerate them. Most stomach side effects from Ozempic or Mounjaro are temporary, but do not push through if symptoms stop you from staying hydrated or cause pain that stays in one place. Do not push through if the belly becomes swollen and stops moving normally, or if symptoms keep getting worse. Expected discomfort improves. Dangerous side effects persist, intensify, or dry you out. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.